Good evening, one and all. It's an immense pleasure to extend to you all a very warm welcome on behalf of IEEE Education Society Kerala chapter to today's interactive session, Recharge Without Charge, organized in association with Mind Empowered Charitable Trust. The specific objective of this session is to provide an insight into the various ways of handling daily life stress. In case of any queries during the session, please feel free to raise the question in the chat box. To begin with the session, let me request Srila Menon, co-founder of Mind Empowered Charitable Trust, for the welcome speech. Ma'am, please.
Thank you, Veena. Good afternoon, everyone. Today, first and foremost, thanks a million for coming in the afternoon to attend our session. Let me tell you a little bit about Miss Anu Suraj, who is our webinar speaker for the day. She's a mental health and wellness professional who's passionate in empowering the next generation and fine-tuning them to being a good human beings. She's an active crusader, mentor, and co founder of a non profit organization which works towards child protection, child safety, upholding child rights through her NGO Swaraksha, which is based in Cochin. And it is an initiative against child sexual abuse. She is the Vice President of Kerala Mental Health Council, a member of Kerala Clinical Counselor Association, and co-founder of Atma Saukhya. She's also the recipient of Bhumika Unsung Heroes Awards and was recognized by Star Networks in the year 2020 for contributing towards wellness and social work throughout the pandemic. Thank you so much, ma'am, for agreeing to take this session for us. Over to you.
Thank you so much, dear Srila. Good afternoon, students. I guess I'll be addressing all the IEEE students. So let me first begin by extending my gratitude to IEEE Educational Society and Mind Empowered, especially to Maya and Srila for calling me over. And as today's topic indicates, it's about coping up with stress. And so before we go ahead with stress management or knowing what is stress, I would like to just bring your attention to mental health, which is gaining as much importance as physical health. So I'll just like to brief on mental health a bit. Hope that's fine, Srila. Okay. Am I audible?
Yes, you are.
Okay. I am unable to see the Google Meet or any of those screens or the chat windows because my screen is, on the slide share mode. So if anything is there, please feel free to, remind me or alert me or whatever. Okay.
Sure, ma'am.
Okay. Thank you. Okay. So the first slide indicates that mental health is as important as our physical health. We would have read or we would have heard or we would be aware that mental health is as much gaining as much importance as physical health. But how do we give attention to mental health? That is a very important question which often comes up. So basically what I've put here on the slide is the cognitive triangle, as we call it. The thoughts, the emotions, and the behavior. That is the thoughts, feelings, and our acts, which comes inside this triangle. Simply put, it indicates how our thoughts change the way we feel, which in turn affects our action, right? And the thoughts will again go back, and it's like a cycle. The cycle just goes on. And when we speak about mental health, we are actually talking about the holistic health, actually, the emotional, the psychological, and the social aspects of well-being is what we are talking about. And basically around us, the how much we can relate to others, our intrapersonal skills, the relationships we handle, the choices we make, all these will come under mental health. So this is just to give you an awareness for those who do not know, those who have not thought about it. You can start giving it a thought right now. And to understand mental health more, there is a slide which says that mental health is something everyone has. Because why I have put this slide is because mostly mental health and mental illness are often confused in a confusing manner, or it is understood or misinterpreted as one thing which is not, which is what I wanted to address first. So mental health is something which is part of us as much as our physical health is. It's just part of being human and it needs to be addressed. So when we think about all the stigmas which uh, concerning mental health, or it's often people do not come out and discuss these topics much. So last year, you would have been shocked hearing Sushant Singh's it was not last year, few years back. So until then, nobody gave much importance to mental health, or it was not discussed. And then there was this sudden wave after he was gone, as to what would have happened. So there was another picture which was going on, taking rounds, where one girl had just put up a birthday picture, and the next day the girl has committed suicide. So people had started wondering, how can one be so happy? How can one put a picture like this the day previous to attempting a suicide? So what we wanted to say is that there is no phase as such for mental illness, or when there is a mental health issue. That's what we wanted to say. And mental health is never a sign of weakness or shame. It needs unashamed conversations, and it is totally different from mental illness. I'll of course take you through the what a mental illness is for sure. So when we speak about mental health, it's a state of well-being, of course, but it's not absence of diseases, but the way we can cope up well, we can function well, we can respond appropriately, and we can perform normally is that is when you say that your mental health is fine. When your functioning is affected, then that means that it needs attention and care. So uh, that's what I wanted to highlight on this before going into the stress management part of it. And yeah, this is just a general information regarding COVID. When the pandemic had started, there were many people who were having, comorbid health conditions, and this placed them at a more socio-economic disadvantage. People who are having severe illnesses, who are having pre-existing mental health issues, maybe they were not aware of it, maybe they had not addressed it, and those were people who had suffered a lot, and they, this associated with a higher level of physical distress and a lower level of life satisfaction. So that is um, yeah, so that's the comorbid. Those people were considered to be vulnerable from a mental health perspective when the pandemic had started. So coming to mental health and mental illness, so this is how you differentiate. um, so mental illness, when we talk about that, it is a serious disorder affecting one's behavior, thinking, and feeling, or when there's a problem for a person to function in work related activities, socially, in the family, occupation, all these things. And it also depends upon the length and duration and the severity of the disability. So this is how you distinguish these three. Mental health issues is when you have a diminished ability to perform, and it interferes kind of with the your day-to-day functioning. That's when you call. And this includes mood issues also. Mood disorders are also placed under mental illness. So I hope this is not too much of a you don't have trouble understanding this here. So I'll move on to the next slide. Yeah, what is mental illness? So when we say in general that I am depressed, actually maybe it's a temporary state of mind. The person may not be having a totally depressive mindset forever, like not throughout the year or anything, but maybe for a very short period of time, maybe a part of a day. Then you do not call it as a mental illness. Only if it is lasting for more than a month, month or 3 months, 2 months, or continuously it's persisting, enduring for 6 months, then you call it a mental illness. Nowadays, we have heard people using this term. Just I have heard kids also saying that I am depressed, I am stressed. They often say all these things. That's because the children are not being sometimes taught to label their emotions, or to vocalize or verbalize what they are feeling. Then it leads to confusion. So they use the commonly used term, such as I am depressed and all. But you should not be using such terms, because it's actually a mental illness, which needs a proper diagnosis and a proper assessment by a mental health professional, right? So these are some of the warning signs which is given here. And here we are talking about persistent or enduring state. It's not a temporary one. So that is the difference. The way you diagnose, the way it will be dependent upon the severity and duration, the length of the course of the disease. That's what we are talking about here. Coming to stress. Okay, so there is a diagnostic definition here, and also how we relate to stress as a layman. So stress is nothing but a normal human reaction that happens to everyone. So our body is designed in such a manner that it's always ready to experience. We are open to experiencing the stress and reacting to it. So, a situation where we feel we cannot manage or control ourselves, that is what we call normally as a stress or a stress response, a feeling of emotional, psychological pain, strain, and pressure, as it is put down here. Okay. And knowing the symptoms of stress. So when we these are some of the symptoms that have been put down here. So when we talk about the symptoms, we can talk about the physical ones, like you having a headache, having difficulty sleeping, muscle pain, having problems with digestion, the gut tissues, BP. All these things can be some of the physical effects. And emotional effects can be mood related ones. Maybe you feeling irritable, restlessness, or lack of concentration, sadness, which is again coming to the mood issues. So all these things can also be the emotional effects. And sometimes you have signs, right? You feel sometimes you feel panicky, you feel excessive worry, you feel fear, you feel you are under pressure. And sometimes people, you know um, you go ahead and what go ahead with drinks, drugs, etc., as a means to cope up with stress. Sometimes it is they overeat, sometimes they smoke it out, and sometimes they withdraw from everything. So these are all ways in which the stress affects us, and mostly it is felt in the form of physical sensations in the body. Yeah, so here I have just simply put it using a Google image. This is how it affects the parasympathetic nervous system and the sympathetic nervous system. So when there is a stressful situation, immediately the body prepares to either fight or flight, to take away from the scene, or to fight it, whatever the situation is. So the system will actually prepare the body for the incoming onslaught, or whatever the stressful situation is. Sometimes, how do you feel stress? Um, can I open the question to all of you? Can you tell me some of the ways in which you have felt, you have reacted? Means your body has reacted to stress, like for example, increased heartbeat. Anything? Did you all fall asleep after eating nice lunch? Because I've come in the afternoon and you're all in a relaxed mode. You have not felt stress at all in your lifetime.
When we get afraid,
Yeah, okay, frightened. Then anyone else?
when
I'm okay to talking in Malayalam also. Okay, I'm just carrying it on without asking you guys if you prefer Manglish language, or whatever. What is it that you want? Should I switch to Malayalam? നിങ്ങളെല്ലാരും ഉറങ്ങാണോ?
Ma'am, I think Ma'am, I think there are a few people who are non-Malayalis also, so I
Hello,
think it
ma'am.
would be
Okay,
better if we stick to
okay,
the
okay,
English
okay,
medium.
okay. Yeah. So anybody else?
Hi, ma'am. Am I
Yeah,
audible?
you are.
Yeah, I'm Aisha. Usually, when I get stressed, my hands sweat very
Yeah,
easily.
that's there. Yes, the palms become cold and sweaty. Yes, you are right.
Then thirst or like
Yeah. Okay. Okay. Thank you so much, Aisha. Okay, so some sensations which you feel like the pupils dilating, or as she said, sweat, like it can be on your forehead or on your palms or whatever. Sometimes you feel increased heart rate, and the breathing rhythm is disturbed. It's not the normal breathing rhythm. And sometimes what happens is that while the sympathetic nervous system gets you prepares your body to fight or freeze or flight, um, parasympathetic nervous system actually calms you down. It prepares your body to take time, calm down, think, and restore your body function. So it slows the beats, it constricts the pupil, it constricts the airways, relaxes the uterus, urinary output becomes high, and all the normal things will be restored. So sensory nervous system is the one which will make you prepare you, and the other one will help you recover from such a stressful situation. So this is just another slide, stress induced changes in the nervous system. Actually, engineering students have a problem with understanding of medical terms. Do you have any such problems? I have a few cousins who are in IT. Then they will tell me, "Ayo, please don't tell me anything related to medicine. Either we can't understand, or it's too boring and all that." So if the slide is too much for you, I'll just go ahead with the next one. Okay. So this is just the changes in the body, stress induced changes, that will commonly happen in the nervous system. It can even include missed periods, low sex drive, stomach ache, weakened immune system, lack of sleep, insomnia, headaches, heartburn, rapid breathing. So take a simple thing like insomnia. It can be like inability to fall asleep, stay asleep, or maybe you are waking up early in the morning, but we may not be aware, that we cannot all these is part of insomnia only, but you may not be aware. You may be sleeping very late, you may be having difficulty falling asleep. So all these things will help you to increase your awareness on awareness level on what you can do. So again, another slide on the other things which we might skip, things like migraine. ഇപ്പൊ കോമൺ ആയിട്ട് ആൾക്കാർക്ക് ഉള്ളതല്ലേ ചെന്നിക്കുത്ത്, വാട്ട് വി കോൾ ആസ് സിവിയർ headaches which happens in the frontal areas between the eyebrows or under the eyes. It affects it's a neurovascular disorder which affects the entire system. For example, we might not be aware that one of the causes can be stress, if you take migraines. So like that. And when it compares to cognitive functions, it can affect your judgment, your thinking capacity, or you may feel dizzy, or that is the sensation. And then it affects the way you eat, the way you sleep, and all these things. Sometimes you don't feel like talking to anybody. So these are all just ways in which it can affect you. All of this may not come for every person. Let's not generalize here, but these are felt like that's how people feel. Okay, so coming to this, like, is stress helpful or harmful? We have seen kids coming and telling us mostly that stress is good for us, no ma'am, because it helps us, it helps us to prepare for the impending danger. If the body responds with flight or fight response, and then it increases our, the way we react, our how we respond, and all that. So it's all correct. Okay, so while the body prepares yourself to face the stress, it also depends upon the level of stress that you're experiencing, whether it is continuous stress, you are experiencing continuous stress for certain period of time, or is it discrete, how frequently you are experiencing it, and what is the intensity. So based on this, you can calculate, you can categorize stress into two parts: one, the acute stress, the chronic stress. So acute stress, when we talk about acute stress will always have a sudden onset. So you will not have you may not be able to realize, you may not understand immediately what it is. So when you are faced with a situation on which you have no control, you are actually feeling fright, and then such a situation. Okay, but imagine a scenario where in a house a person is constantly fighting with the spouse, or another situation where there is a toxic work environment. So in the cases, what will happen? The stress will happen. There will be a sudden onset, and that is when we experience acute stress. Chronic will be when it happens long term. That is, it's happening continuously for a long period of time. Okay, so coming to the important part of it, how do we actually cope up with stress? That's what we need to understand. So, awareness is definitely the first step. Educate yourself and read more on how this happens, what is stress, how do you manage, what is the source, how does it happen? എവിടെ നിന്നാണ് നിങ്ങൾക്ക് സ്ട്രെസ്സിന്റെ സോഴ്സ് വരുന്നത് എന്നുള്ളതാണ്. അതായത് വീടാണോ, or the work environment, or the college environment, and find ways to stay clear. At times it's not possible when you don't have a control over the source, but what you can do is you can prioritize, you can draw boundaries. Okay, I'll come to all those things. Then second is the recognizing the signal. നമ്മുടെ ബോഡി തന്നെ കുറേ സിഗ്നൽസ് തരും അല്ലെ. തിങ്സ് ആർ നോട്ട് ഓക്കെ, യു ആർ ഫീലിംഗ് ദാറ്റ്, പെട്ടെന്ന് യു ആർ ഫീലിംഗ് എ പാൽപിറ്റേഷൻ, or sometimes you are feeling a panic attack kind of a thing. You want to lie down, you're suddenly you're feeling your hand is shaking, and the hyperventilation in the legs and all those things happening. You know that you are not okay, right? And the third thing is share the feelings. You are not alone. You can always share it with somebody who is ready to listen to you and who can understand you. Don't don't go to a point where you are breaking down. Okay, so don't be too hard on yourself. Being self-critical can also be really difficult. That okay, ഞാൻ ഇതൊന്നും ചെയ്തിട്ടില്ല, I'm way too far behind my work while others have gone ahead, and lot of negative thoughts which comes in, that can get really difficult, and it can cause issues. And also create a a network of friends to whom you can share your feelings. And then you have time management techniques which you can try. Prioritizing, being engineering students, I don't want to lecture more on that. Then you can try relaxation trainings. There are many ways of relaxation. One is the mindfulness based stress reduction, which I've put it in here. Mindfulness. I just love that theory of mindfulness. I don't know how many of you are aware. I'll anyway take you through that. Then finally is seeking medical support or mental health professional support, or whatever, whenever you feel like. So when seeking support is not a sign of weakness, but rather a feeling of strength. Because എത്ര പേർക്ക് തുറന്നു പറയാൻ പറ്റും ഞാൻ ഐ എം ഗോയിങ് ത്രൂ സംതിങ്. Okay, shall I ask one question to all of you? How many of you don't feel reluctant to come out and tell that I'm not feeling okay right now, or there have been situations where I have had a very difficult time coping up with something. ഭയങ്കര ബുദ്ധിമുട്ടല്ലേ അത് പറയാനായിട്ട്. So it takes immense strength to come out, but getting support is very important, right? Okay, so yeah, so there are different approaches. This is your takeaway. So how do you cope up with all the stress? There are three approaches which I've put here. One is action oriented, emotion oriented, and acceptance oriented. Go through each one of them. So these are some of the action oriented techniques, and I'm always in for the mindfulness technique. So mindfulness nu parna endana? Normally we ask this question to student and ask them to think over it. Is your mind full, full, or are you mindful? Adana question. Okay, I'm just putting this question before you so that you think about that for a second. നിങ്ങളുടെ മൈൻഡ് ഭയങ്കര ഫുള്ളായിട്ടാണ് ഇരിക്കുന്നത്. ഞങ്ങൾ ഉച്ചയ്ക്ക് വന്നിട്ട് ഈ മാം എന്തൊക്കെയാ പറയണേ, സ്ട്രെസ്സും അതും ഇതും ബോറടിച്ചിട്ട് വയ്യ. ഏതർ ദാറ്റ് ഓർ യുവർ മൈൻഡ് ഇസ് കോൺസ്റ്റന്റ്ലി റിവോൾവിംഗ്, തിങ്കിങ് സംതിങ്, എന്തെങ്കിലുമൊക്കെ ആലോചിച്ചുകൊണ്ടിരിക്കുകയാണോ, ഓർ യു ആർ മൈൻഡ്ഫുൾ? If you're mindful, if I ask a question, you'll be able to answer. So that you can test for yourself. That will be the level of your mindfulness, which means that how much you are staying in the present. Okay, your self awareness is what I'm talking about. Mindfulness എന്ന് പറഞ്ഞാൽ അതാണ്, how much you are aware. If I ask you, what did you eat in the morning? How many of you will be able to say immediately, like dosha, idli, puttu, or whatever, chapati, paratha, whatever? So അത് എത്ര പേർക്ക് പറയാൻ പറ്റും എന്നുള്ളതാണ് നമ്മൾ നോക്കുന്നത്. Or if I ask you, what did you wear yesterday night? What color dress did you wear? Have you noticed the plant around you? How many plants are there around your building when you go out? ഇതൊക്കെ നമ്മൾ ശ്രദ്ധിക്കാറുണ്ടോ? ആർക്ക് സമയം, നമ്മൾ പോവും വരും അല്ലേ? So
I look around.
You look around. That's very good. That's very good. You have to. Yeah.
I noted in my diary.
Okay, really happy to hear a response. ഇല്ലെങ്കിൽ ഞാൻ പറയായിരുന്നു, like ever since COVID began, no, I've been speaking to a lot of students like through my NGO. Appa I always see the video which is all switched off and all that. അപ്പൊ ഞാൻ വിചാരിക്കും ഞാൻ പാരനോർമൽ ആക്ടിവിറ്റി ക്ലാസ്സിലാണ് ഇരിക്കണേന്ന്. Because I can see whoever is on the other side. ഉച്ചയ്ക്കൊക്കെ ആകുമ്പോൾ കുട്ടികൾ ചിലപ്പോൾ കിടന്നിട്ടൊക്കെ ആയിരിക്കും അറ്റൻഡ് ചെയ്യുക. So it's difficult, right? Yeah, okay. So once in a while, one of you can unmute and respond. Okay. So thank you for that. So yeah, it's really good to pay attention to the present moment, because it helps us control our racing, repetitive, and non-productive thoughts. Okay, which is actually leading to the stressful situations at times. എപ്പോഴൊന്നും ഞാൻ പറയുന്നില്ല, but at times. For example, imagine or supposedly you are waiting for somebody to turn up, okay, or you are expecting a text from somebody, maybe a friend or a boyfriend or girlfriend or some relative, or it can be anybody. Okay, the text did not come, and then you start thinking what would have happened to the person. ഇനി വരുന്ന വഴിക്ക് എന്തെങ്കിലും സംഭവിച്ചിട്ടുണ്ടാവോ, any accident, or maybe the person doesn't love me, or why is she not coming on time, why is she keeping me wait, is she not interested in me, and the rumination starts, right? അങ്ങനെയല്ലേ നമുക്ക് തോട്ട് വരിക, and we think and we create a lot of thoughts, which self created thoughts is what we will say അല്ലേ? അപ്പൊ നമുക്ക് how do you change that? By purposefully or mindfully distracting yourself from the thoughts. That way you change your reaction by choosing to pay attention to what is occurring now at the present moment is how you will distract yourself constructively. അതാണ് മൈൻഡ്ഫുൾനെസ് പറയുന്ന കാര്യം. Okay, and all the other things, mindfulness actually uses yoga, meditation, and other techniques, like guided imagery, kore techniques in there, which is often being used in the MSBR classes, which will actually help you to cope up with the stress. Deep breathing, yes, of course, I'll give you a deep breathing technique towards the end of the session. Then all the physical distractions, positive distractions that you may use when you are in a group, if a college activities, or exercise, yoga, whatever. So when you involve in all that, it is productive activity which will actually put a small curb to the ruminative thoughts that you are having. Another very important another point is on about setting boundaries. പലപ്പോഴും നമ്മൾ ഒരു ബൗണ്ടറി വരയ്ക്കുമ്പോഴത്തേക്കും often we feel stressed sometimes because we cannot say no to certain people or to certain situations, right? നമ്മൾ എന്തായാലും ലൈഫിൽ അങ്ങനത്തെ സിറ്റുവേഷൻസ് ഫേസ് ചെയ്തിട്ടില്ലേ? സപ്പോസ് ഐ എം ഹാവിങ് എ വെരി ഫാൻസി കാർ ആൻഡ് ഐ എം ഓക്കെ ടു മൈ ഫ്രണ്ട്സ് ടേക്കിംഗ് ഇറ്റ്, എനിക്ക് വലിയ കുഴപ്പമൊന്നുമില്ല. ബട്ട് ദെൻ സംബഡി ഈസ് കമ്മിങ് ആൻഡ് ആസ്ക് മീ, മാം ക്യാൻ ഐ ടേക്ക് ഇറ്റ് ടുമോറോ? അല്ല, എനിക്ക് വേണം, അനു എനിക്ക് തരുമോ എന്ന് ചോദിക്കുകയാണ്. ആൻഡ് ടുമോറോ ഐ ഡോണ്ട് വാണ്ട് ടു ഗിവ് ബിക്കോസ് ഐ ഹാവ് അതർ തിങ്, ബട്ട് ഐ കാൻ സേ എ നോ to that person. പിന്നെ സ്ട്രെസ് ആയി, ഓ ഞാൻ എങ്ങനെയാണ്, how will I refuse this person? I'm just saying an example of a car, it can be anything. You cannot say no. So what sometimes people resort to passive aggressive techniques. So instead of that, what we can reinforce is assertion. ഞാൻ ഇട്ടിട്ടുണ്ട്, being assertive. You can be kind and say no. അയ്യോ നാളെ പറ്റില്ല ട്ടോ, I'm very sorry, I can't lend it to you tomorrow, maybe another day you can take this, so it's not okay for you to take it tomorrow, I've got some. അങ്ങനെ നമ്മൾ കൈൻഡ് ആയിട്ട് അല്ല, you can be compassionate, but at the same time you can tell that it's not possible. So അങ്ങനത്തെ ഒരു assertiveness ആണ് നമ്മൾ പ്രാക്ടീസ് ചെയ്യേണ്ടത്, which will also reduce the stress, and also the relationship will not get affected. Time management, of course, is related to how constructively you manage the time, how you prioritize your goals and other things. And distraction is what I was mentioning all these all this while. Next one is management oriented techniques, emotion oriented ആയിട്ടുള്ള ടെക്നിക്സ് ആണ്. Affirmations, like positive affirmations in the law, positive statements that can help you to overcome all the self sabotaging thoughts that we have. Self sabotaging എന്ന് വെച്ചാൽ എന്താണ്, നമ്മളെ തന്നെ കുത്തി നോവിക്കുക അല്ലെ. I'm useless, I'm worthless, എന്നെ എന്തിനു കൊള്ളാം, അങ്ങനത്തെയൊക്കെയുള്ള തോട്ട്സ് നമുക്ക് ചിലപ്പോൾ വരില്ലേ. സംബഡി വുഡ് ഹാവ് മെൻഷൻ സംതിങ് ആൻഡ് വി വുഡ് ഹാവ് ഗോൺ ബൈ ദ ഒപ്പീനിയൻ ഓഫ് ദാറ്റ് പേഴ്സൺ ആൻഡ് വി വുഡ് ഹാവ് ടേക്കൺ ഇറ്റ് റിയലി ഹാർഡ് ഓൺ അവർ സെൽസ് ആൻഡ് ദെൻ it becomes self-sabotaging and negative thoughts. So in these cases, affirmations, positive affirmations can be really helpful. That's also we also use that in therapy very often. Guided imagery is also a relaxation technique which will involve, asking a person to visualize positive, a peaceful or a happy setting, and adu bhayangara effect aanu. If you all have time, we can do a small imagery activity, paper and pen activity, if time permits, and if you all have paper and pen, we can do that. Okay, adu cheyan samayam undo enikku ariyilla, we'll just try. So that is how that is one of the techniques. And then you have the cognitive restructuring എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ നമ്മുടെ തോട്ട്സിനെ മാറ്റി മാറ്റി പിടിക്കുക എന്നുള്ളതാണ്. ഓക്കെ, സോ ദാറ്റ് ഈസ് ഓൾസോ പാർട്ട് ഓഫ് തെറാപ്പി. സിമ്പിൾ ആയിട്ട് പറഞ്ഞു കഴിഞ്ഞാൽ, ആൻഡ് ദെൻ യു ഹാവ് ദ ABC technique. ABC technique is nothing but there is an event which will be happening and we will be having certain thoughts or beliefs or anything related to that event, and then we act based on that. Okay, so when you question your thoughts, then you will be able to control the action, and avada namukku stressful situation കുറയ്ക്കാൻ പറ്റും. ഞാൻ ഇങ്ങനെ പറഞ്ഞ, if you have difficulty in comprehending this, I can just tell you an example. Suppose you're crossing the road and you saw a person on the opposite side. നിങ്ങൾ രണ്ടുപേരും you are crossing each other. You saw the person, you're trying to smile, the other person has seen you is what you feel, but is not looking at you, smiling at you, but then walks over and goes to the other end. അപ്പോൾ നല്ലതായിട്ട് അറിയുന്ന ആളാണ്, and you feel very bad about it. You feel unhappy, you feel stressed, you have a lot of questions. Why did that person not look at me? Or that person has seen me എന്നിട്ട് ചിരിച്ചിട്ടില്ല. That person did not smile, did not respond, did not. പിന്നെ thoughts ആയി അവിടെ, you feel very stressed. You are thinking about this for a long time. The person has meant a lot to you and ഇപ്പൊ മൈൻഡ് ചെയ്യുന്നില്ല, and then it's ruminating again. So in that case, question yourself, question your thought. What if the person has not seen you? ചിലപ്പോൾ കണ്ടിട്ടേ ഉണ്ടാവില്ലായിരിക്കും അല്ലേ. സോ ഇറ്റ്സ് ജസ്റ്റ് ദ വേ യു തിങ്ക്. ആൻഡ് അപ്പോൾ ആ നമ്മുടെ ബിലീഫ്സിനെ ക്വസ്റ്റ്യൻ ചെയ്യുന്ന ഒരു സംഭവത്തിനെയാണ് നമ്മൾ ABC ടെക്നിക്കിലൂടെ ചെയ്യുന്നത്. ഇറ്റ്സ് ആക്ച്വലി കോൾഡ് കോഗ്നിറ്റീവ് റീസ്ട്രക്ചറിങ്, ഓർ that's what we use in therapies like CBT. Okay, so this is all for chronic stress and the ways to cope up the stress. Then acceptance oriented is where you go into talk therapy and talk it out with a person who will give you a safe space to talk about all these things. Sometimes keeping a journal will help. Sometimes you have the resilience building activity is something which is new I have put here, which is nothing but the way you build your confidence, your awareness, your problem solving skills, your patience, your tolerance. Adellamana adile varunathu resilience building. It will need, you have to work on it. It will not happen overnight, but slowly you will have to work over it and then come to a conclusion. But for a cherry or a stress in if you get a nice massage for yourself, or you go out, watch a movie, or engage in some outdoor activity. Some people get our sound vibrations are bhayangara powerful ana. So some people get change get a change, positive change in their mood and other things by just listening to simple music. Some children actually told me, like during the pandemic when we were doing sessions for children, kore kuttiyala, they actually told me that they listen to some kind of a music before sleeping. YouTube la they listen so that they get sleep. അവർ അത്ര stressed ആണ് ഓൺലൈൻ ക്ലാസ്സസ് എടുത്തെടുത്തിട്ട്. കുറെ കുട്ടികൾ അങ്ങനെയൊക്കെ പറഞ്ഞിട്ടുണ്ട്. So it's like there are many ways on de-stressing or the coping up with the stressors. So that's again the acceptance oriented technique. Okay, and I've just put some slides related to suicidal tendencies, how to identify the warning signs. So when somebody is talking about or having thoughts about death, somebody is searching for ways to end life, Google ഒക്കെ search ചെയ്ത് നോക്കുകയാണ്, or reading books or asking people about it, talking about feeling hopeless, or they feel they don't want to live എന്നുള്ള ഒരു സംസാരമൊക്കെ വരാണെങ്കിൽ, or they are in some kind of, they feel trapped, they feel worthless, helpless, all those feelings, all the negative emotions coming out, and they say that I am a burden to others. So അതൊക്കെയാണ് ഒരു കുറച്ച് പോയിന്റ്സ് ഇവിടെ ഇട്ടിരിക്കുന്നത്. They are like warning signs. ആ കേസിൽ definitely you have to help the person out. If the person is yourself, you have to come out and talk about it. Okay, yeah, this is the continuation of that. The person is using increased amount of alcohol or drugs, they are sleeping too little or too much, they are having a social withdrawal as we spoke about earlier, and somebody is having extreme rage or ഭയങ്കര റിവെഞ്ച് മെൻറ്റാലിറ്റി അല്ലെങ്കിൽ ഭയങ്കര മൂഡ് സ്വിങ്സ്, അങ്ങനെയൊക്കെ വരുമ്പോഴും നമ്മൾ we have to identify that this is not okay, and especially when it is affecting the activities of daily living. So these are some simple techniques which we can do. You can just be a listener. You don't ask for any questions, don't probe or don't judge. Don't say that നിനക്ക് വേറെ പണിയൊന്നുമില്ലേ, അങ്ങനെ ഒരിക്കലും പറയരുത്. That's like rubbing on the wound. So never do that, because we do not know what the other person is going through, what is in his mind, what thoughts he are having. So what we can do is being supportive and give some hope, offering help by asking ഞാൻ എന്താണ് ചെയ്യേണ്ടത്, how can I help you എന്നുള്ള കാര്യം ചോദിക്കാം. Okay, and then they have put like building a contract by asking, will you promise me not to kill yourself till I find a help for you. So this is what you can do immediately. This is the crisis plan for only in those cases where the person is having a suicidal thought or an ideation. Okay, then as this I think we have already discussed about all these things. Calling and talking to a mental health professional or counselor or an expert can definitely help. Don't rely too much on the information that is available in the internet, especially if the source is unreliable, or if it cannot be trusted. Nowadays you have a lot of information available in the internet, too much ആണ്. So we do not know that ഇതിൽ എന്തൊക്കെയാണ് കറക്റ്റ് എന്തൊക്കെയാണ് റോങ് എന്നുള്ളത് നമുക്കറിയില്ല. I just wanted to try one of the breathing techniques if you all are up to it, but I will just want you to open up your, like video on cheyandi varum. So I'll give you some time to think about it. We can just do 4-7-8 breathing if you are all up to it. Okay, and you can practice this. 4-7-8 is a very powerful method of, it's a breathing technique which is often used where you become aware of your breath, that is the breathing, as well as you will also be aware, or you will also be counting, so you are mindfully distracting yourself. And then, so if you are all in for this, we can do that. We still have time. Yes, okay, Maya is nodding.
Actually, there might be some questions. Do you want to take the questions first, or you want to do the exercise first? How do you want to go about it, Anu?
Anything is fine.
Okay. So actually, just before the questions, there's something because this is IEEE branch. Some of you know about Mind Empowered, some of you don't. So I have a very short video to play about Mind Empowered. It's hardly a minute or two. So we'll go through that and then we'll go to the questions round. So here you go. Thank you. Thank you so much for that. Thank you for that time. Any questions, guys? You can please either unmute yourself, you can put it in chat, you can please ask any questions, and Anu ma'am will surely answer. Thank you for that. You can ask any specific questions you have for stress management during exams or interviews, or how you want to deal with things. This is your chance.
I wanted to ask about assignments. Because submitting assignments is really stressful for me. Can, can you please suggest any stress relief methods for that?
Hi, Arul. What was that question? You feel stressed when it comes to your submitting your assignments.
Yes.
Okay. So what do you experience actually?
I became angry that time.
Okay, you are not able to write the assignments, or where was the struggle? Like planning to do the assignment, like setting time for that, or every day on a struggle?
It is about the time because I can't write it fast. That
Okay, you
when
can't write fast. That is your
I
struggle,
will
right?
be really slow, and I start doing when it is night time also.
Okay.
Because of that,
Okay.
also I feel sleepy that time. Then I am really angry.
Okay. So you try to start your assignments by night time because that is only time you're free. You don't have any other time, the entire day.
Not, but I only remember about the assignments when at the night time. That the rest of the time I'm doing from I think
Okay.
6 to 8. I will be studying and all, but I don't do assignments from that time. Then I think about assignments before I sleep.
Okay. Okay. So see, mostly when we are active, no, when we are doing a lot of things, when our mind is stuffed, so we often forget when it is cluttered. That is the right word. So then sometimes we tend to forget or not remember what is to be done and all that. So what we can do is we can constantly put reminders. Okay, either you can put do you use this sticky notepads at home, like any kind of കുറച്ച് കളർഫുൾ ആയിട്ടുള്ള sticky
Yeah,
notepads ഇല്ലേ, all those,
I
yeah.
used it. Now I don't use when
Yeah,
it is over now, so I don't use it.
Do you have a feeling that it is only for small children?
No, I don't feel like that.
Okay. Okay, so then there is no problem. You can just take some colorful sticky notes and put it all around. Okay, in your room. Nobody is going to bother, but you're going to benefit only from that. So keep as many reminders as possible. And if you're a person who is watching a lot of videos in phone, if you use phone also, you can keep a reminder or an alarm clock in that, so you can better manage that thing. The problem is that when we tend to do too many things, the mind is often cluttered with a lot of things. So we are not prioritizing what is immediately needed. So you can prioritize. You can also make a journal, like as you do the diary writing and all, you can have a journal and you can write it in that also, like what is the first work that has to be given priority, and then the next, and then the next. So those things which are okay to be postponed slightly to the next day or even to the weekend, you put it down, and the one which needs to be given importance, you place it high. Okay, and sticky notepads is a easy way of grabbing your attention. and so that you are reminded of okay, there is such and such thing which I need to do, which I need to complete before that time. So that is how you can manage. It's one easier way. Okay, can you try that?
Okay, ma'am. I will. Sure.
Okay, thank you.
If anyone else having any doubts, please do feel free to put it up in the chat or maybe unmute yourself and ask to Anu ma'am. Thank you, ma'am, for your response.
Hello. Good afternoon. Can you hear me?
Yes.
Okay, so I'm Zada, and my grandmother has been having some anxiety issues lately.
Okay.
So she went to the doctor, and they recommended a psychologist. I'm sorry, a psychiatrist, but she is not willing to go and see the psychiatrist after that first session. She believes that all these stress are normal in people's life, and being a little aware of mental health issues. When I try to tell her, she is not, she doesn't want to go for many more sessions to, better herself.
Okay.
Even others in my surrounding, they also tell them it's not important. You will get addicted to these pills and things like that. So what do I do in such a situation when people don't understand, or
Okay.
make themselves aware of this situation?
Hmm. Yeah, thank you, Sada, for the question. Actually, this can be very daunting because mental health issues are not often addressed, and people do not have the as many insights on this. Now it is just gathering momentum, and with NGOs like Maya's, or maybe our Swaraksha, we are all working hand in hand. Our mental health council to spread and remove the social stigma. It's not easy. We know that, and even sometimes it can be met with contempt. And here in your grandma's case, we do not know what kind of experience she had with the doctor. So maybe you can ask her more about that. So where is she feeling uncomfortable? What is the thing that is making her uncomfortable? Is it the drug? Is it the allopathic medication? Or if it is, then you can give her more options like the alternative treatment methods. Like there are the homeo doctors. We have one Vinod Joseph doctor in our panel also, who is a homeopathic physician, and he caters to mental health issues. Okay, so there are a lot of people who have been to him, and they have, some people don't like allopathy. It's one person's that's up to that person. So we cannot force them. If the person dislikes allopathy, we cannot force them to have allopathic medication. So that is one thing. So you can just be around. She'll come to you. It will take some time. Even when we are trying to change the mindsets of people in a society, it's not easy. It cannot happen overnight. It will take a lot of time. You have to be really patient and consistent with this thing, to achieve the desired result. But she might come around, and if you can kindly listen to her more, ask her what is the one thing that she is facing, why is she feeling like this, why she doesn't want to open up, or then you can ask her if she's ready to talk to a psychologist. Instead of, she can have her medicines, but at the same time, you can address the issues in a more, where there is a space for her to talk elaborately about issues, where she can have multiple sessions, like go once in a week or something like that. Maybe she can try all those, a combination of all these things. And then you can keep saying all these things around to her, and again without accepting defeat. I know it's a very difficult situation, but yeah, you can make her aware. There are plenty of videos, but take good ones, which talk about mental health. Like I said, the reliability of a source is a very important thing. So when I talk about this, I suddenly remembered that there was a girl who used to come to me. We used to have talk sessions like every once in a week, and she was doing very well. Then suddenly one fine day, she seemed very down, and she came and told me that I'm not quite okay. Then I asked what happened to you, because she was feeling really good. നല്ല മാറ്റം ഉണ്ടായിരുന്ന കുട്ടിയാണ്. Suddenly she came and asked me. Then she told me that, ma'am, I think I have maladaptive daydreaming, is what she said. So I had to listen very hard, and I asked her, what is it? Then she said it's maladaptive daydreaming. So I was just trying to, you know, process the word myself for some time. Then I asked her, from where did you get this and why do you feel that you have this? So then she said that I saw it in a YouTube video and I strongly feel I have this, because she's actually a very artistic person. She's creative, she uses a lot of her imagination, and she's a thinker. So basically she spends a lot of time thinking, and daydreaming, fantasizing, which is not a bad thing at all. But then only if it is affecting her functional living, it will become maladaptive, right? So then it has not gone to such a point, but she strongly believes that she has this. So that is the effect of, you know, watching a video, or if it's not a reliable source, these things can also happen. So you have to be very careful from where you're taking the video, what is the source and all. Okay, so you can spread awareness in that manner also.
Okay, ma'am. Thank you so much.
Okay, Sada.